Couples who have problems with infertility know just how heartbreaking it can be, but several recent studies may bring a little hope to those men and women wanting to have a baby. As Today in LA's Kelly Mack reports, this new treatment is actually thousands of years old. It's acupuncture.
Let's have you stick out your tongue.
Dr. Mindy Boxer checks on her patient Cecilia Mondragon, who is 9 months pregnant. The 29-year-old Mexico City native started seeing the Santa Monica acupuncturist about 18 months ago after traditional treatments failed to correct polycystic ovary syndrome, which caused Cecilia to have infrequent and irregular periods.
I feel really bad. I was taking drugs and medication for around 8 to 10 months. And after that, I quit because it didn't work at all. And the only diagnosis was, okay, I have to increase the doses that you're taking.
So she went to Dr. Mindy Boxer and began acupuncture treatments.
The acupuncture started working with me since the first treatment. I got my period, I never had like a regular period.
And about 9 months later, she was pregnant.
Right now, I am practicing the Hunyuan method to treat infertility, which is an approach of Chinese medicine utilizing weekly acupuncture treatments and weekly herbal prescription.
In the Hunyuan method, the goal is to address all of the underlying issues to make the woman healthier and therefore more able to conceive.
Your body and your reproductive system and your endocrine system did not get like this in one day. It was months and months and years that got you to this point. So with that in mind, it may take months for you to get back to a place of harmony and balance and endocrine health so that conception can occur.
Traditional infertility specialists like Dr. Margareta Persarska, the co-director of Cedars-Sinai's Center for Fertility and Reproductive Medicine, say several studies indicate acupuncture can be helpful in treating infertility when used with in vitro fertilization.
They did find a higher pregnancy rate in the women who did undergo acupuncture compared to the women who did not.
And she cites limited proof that acupuncture can help with low ovulation rates and even low sperm counts. But she says don't substitute it for traditional therapies and never pair them with Chinese herbal treatments.
Although acupuncture is a safe adjunct, they should not use any other of the herbal therapies that are present or administered with acupuncture, because the herbals do have some medicinal role and they may interact with the more traditional therapies that we are giving our patients.
The traditional philosophy of acupuncture is to allow for the normal flow of energy, or qi. The goal of acupuncture is to put the person's qi, or flow of energy, back in balance. And like most acupuncturists, Dr. Mindy Boxer believes in looking at the patient as a whole, not simply at reproductive issues she may be suffering.
We would want to look at what pattern of disharmony is presenting. Is this person naturally cold? Is this person warm-blooded, but they have cold hands and feet? Does this person have an energy drop from 3 to 5 every day? How is the person's sleep, digestion, elimination? Do they have times of day where there's abnormal sweating? So all of these and many other factors are taken into consideration.
Dr. Boxer's prescription worked for Cecilia Mondragon, but other doctors say don't take that as a guarantee it would work for everyone. For more information on the Hunyuan fertility treatment, go to drmindyboxer.com. For Today in LA, Kelly Mack, Channel 4 News.